This is Mindbloom ketamine therapy. It is a at-home ketamine therapy with an 89% success rate to help replace those clinic visits at a 75% lower cost. But the big question is it safe? How's the customer service? Is this actually effective? I think when most people hear ketamine, they think going to a rave and doing drugs, but ketamine is actually a psychedelic that can help with a variety of mental health challenges. And I can say that I personally have actually used Mindbloom before. They did send this kit to me. This is new. I used them early on, I think during like COVID 2021-ish range to help with like some things that I was going through. And it did help me a lot. So I think it's important to kind of raise awareness. I always recommend do your research, learn about things before you dive into them. Just because it worked for me doesn't mean it's going to work for you. But I'm going to show you what comes in the box and what the experience might be like for you. Now, this is their Bloom box that arrives when you purchase a experience, and inside of it, you're going to get a blood pressure monitor because you always want to make sure your blood pressure is at a good amount when you're doing any kind of therapy, psychedelic therapy, which Mindbloom helps support. And you'll have a guide who makes sure that you measure it. You get a good number that's safe to help continue the process. Comes with a charger as needed and a manual on how to use it. During the experience, you're going to blindfold yourself and listen to a music track. So they provide this blindfold, which is very comfortable. Wraps around your eyes. It doesn't press on your eyes. You can block out the light with your nose as well. So I do appreciate that. And then they come with a journal. So I kind of wish I had my Mindbloom journal, which I do have a lot of writings from, experiences and thoughts. But in here, empty journal, I can go ahead and reflect on my experience, write about it. They're going to give you questions, and Mindbloom is essentially your guide. You're going to use the journal, the medication, which arrives separately, blood pressure cuff, eye mask. You have a guide. You'll go through a checklist. You want to set aside 2 hours. Take any anti-nausea medication. You need a place that's safe, clean, and won't be interrupted. And then you're going to enter a phase of neuroplasticity, which means your brain is going to be able to modify itself in very beneficial ways. You'll journal on that experience, write it down. You'll meet with your Mindbloom guide after, and you'll do a couple of those sessions. I think I did 3 or 4. And over that time period, you're going to really allow the medication to kind of guide you in some ways, but also work on reflecting on these moments and really bringing positivity into your brain. And I got to say, it helped me a lot. I wouldn't say it's like something that's going to be insane, like you're going to feel like something crazy, but it helped me progress forward and maybe open up my mind to ideas that, I was pushing up against. So this really helped me. I actually did really like it. We'll have a link in the description. If you click that, it'll help support the channel. Now, who is this really for? It's for treatment-resistant depression sufferers, high-functioning anxiety patients, PTSD survivors, and more. And if you've tried 3+ traditional antidepressants without meaningful improvement, this can be helpful. Chronic anxiety, depression affecting daily fluctuation, PTSD. And if you can't afford those $3,000 a month traditional ketamine clinics, this is an alternative. And if you live in one of the 35 eligible states without local ketamine clinic access, you can use this too. So the initial program is about 6 sessions over 3 months. It'll be every 2 weeks. It's about 60 to 90 minutes of active experience. Your dosage can range from 400 to 750 milligrams of ketamine per session, and you'll take lingual tablets or subcutaneous injection. When I did it, it was just the tablets. You put it on your tongue and then you spit it out after a period of time, and then the medication will start to take effect. But now they also offer injection vials as well. You will have medical oversight, so there's a psychiatric evaluation. Make sure everything is okay before you go into this, because you are testing something that is very new, but it is FDA approved now for certain situations. You'll have check-ins throughout the time. You want to check your blood pressure. There's a lot of like safety protocols around the experience to make sure that it goes all in well. And then this is how it works. The first 10 to 15 minutes, you kind of like have that sublingual administration. You get the medication. 30 to 45 minutes in, you're going to peak. And then 60 to 90 minutes, you're returning to baseline. But you do not want to drive after that. You're going to feel a little woozy. It's kind of like you're a little drunk. And then 2 to 4 hours, it takes 2 to 4 hours to fully feel normal. And the full relief duration can be 1 to 2 weeks. And that's why they do it every 2 weeks. You'll reflect the journaling. The work outside of just the medication session can be really impactful. And it's like really important. And I think they do an amazing job of guiding you through that, asking questions and working through. They do have a 24/7 access to a care team if needed, if anything goes wrong. You really have to be 18 years or older, available in 35 states. And you cannot have medical screening that has, psychosis history, uncontrolled hypertension, severe personality disorders, active substance abuse, and there's about a 65% acceptance rate. So not everyone's going to get it. It's just they want to be safe and smart about this. And there's been a lot of large-scale studies that have shown no side effects. So they're really going to just make sure they're tracking everything, make sure everything's going well. But just know, over 50 million Americans experience mental illness, and there's just not a treatment for it. And this is a route that people just don't talk about. I think psychedelics have really been pushed down in terms of doing research, and we've fallen behind due to the FDA and different drug laws that have prevented that from happening. So I think it's really exciting that we're now opening up these avenues where this medicine can actually help people's lives, and we're giving the space to do the right research on it. And a lot of people have had some concerns online, like billing issues, medical shipping delays, difficulty reaching support. So these are things just to keep in mind. It's a business. Things can happen. There might be longer wait times for non-urgent questions, but their company is always working on improving these things. But from an experience standpoint, I think they've done a great job of making sure your experience goes very well, having a solid structure, having the person to work with, the coaching time. So if it is something you've thought about, one, do more research. Do more research. Do not listen to what I say. Learn from other people's experiences. And then if you really feel like this is something that you want to do, then go ahead and sign up. The link is down below as well. Just know the total cost could be around $1,200 for 3 months, 6 sessions, about $500, $418 a month. You will go through 6 ketamine doses. And then there's like returning clients cost as well, which is much cheaper than the typical $3,000 per month typical prices. And there's like other like traditional IV ketamine clinics, Bravado, Joyous, Interwell, and then just classic traditional therapy as well, which I think we should always be doing things to work and better improve ourselves. So I think psychedelics can be scary. They are going to rewire your brain in some ways, for better or for worse. So being very careful, diligent. There's a lot of things we still don't understand, but there are a lot of things we do understand. And it can be helpful if you've tried everything else out there and they don't work. So go research, learn some more stories. This is mine. If you want a more in-depth story about my experience, I can make that on the main channel. So let me know in the comments below. This is Mindbloom, at-home ketamine therapy. Subscribe to notifications. We'll see you in the next one. Peace.